You have seen the picture, Pavez has shown you. Just 100 years before, the Spanish flu epidemic or pandemic had thrilled the whole world, and almost 50 million people were killed. And recently, I think all of you must have experienced the swine flu pandemic, which has threatened the whole world, and many have become panicked to be injected with the influenza vaccine. So the history starts from there. Few facts about diabetes. You know that 415 million diabetic at the world now, predicted to be 640 million by 2040, and the expanding number not only increases the morbidity mortality but a huge financial burden on the country regarding the illness. And lot of vaccines approved by the CDC, the influenza vaccine tops the list for a diabetic, along with the other vaccines like pneumococcal, hepatitis, zoster, and the MMR. This has already been discussed about the orthomyxoviridae, type A, type B, and type C viruses. Few facts I'll tell about the prevalence: 5 to 10% adults infected in a year, 20 to 30% children infected in a year, up to 5 million cases of severe illness and 5 lakh deaths each year. And if you vaccinate the diabetics who have 3 times more risk of hospitalization, almost 28% reduction in the deaths and 79% reduction in hospital admission. The patients with heart disease, there is almost 50% decrease in the heart attack occurrence, which is almost 5 times more than patients not having heart disease. There are of course 3 times more risk of experiencing a stroke after influenza, and after vaccination it decreases by 24%. And the number one risk for influenza mortality, the long diseases already discussed by Dr. Raja, and there is significant reduction on the exacerbation. You have seen the data. So with this much of benefit, just with one seasonal annual vaccine, why should not we practice that? That should be asked to each and every physician. Few basic immunological mechanisms which creates the beta cell damage and insulitis in the pancreatic beta cells. This is a insulin sensitivity cartoon, and this is a cartoon where there is insulin resistance. Lot of immune markers come into play, and autoimmune insulitis takes place. So every diabetic has a deranged immune system, and autoimmune activation takes place. Lot of interleukins, lot of free fatty acids, autoantibodies, and CD8 and CD4 T cells are altered. So if you will see, the leukocyte adherence is decreased, the chemotaxis is decreased, the phagocytosis is decreased, antioxidant activities is decreased, and finally the polymorphonuclear functions, particularly when diabetes is uncontrolled, is seen in each and every diabetic. The vaccine's response is preserved because it involves humoral immunity, and most of the derangements in diabetes is related to cell-mediated immunity. And another important thing, improving the glycemic control improves the immune function and improves the vaccine efficacy as well. So this already we have discussed with several immunological changes, and cell-mediated immunity is most affected, and there are of course reduced T lymphocytes, neutrophil functions, change in humoral immunity, antioxidants, and the hyperglycemia brings these changes. A very complicated cartoon of the effects of hypoglycemia. I'll summarize in this picture that the pathophysiology of infection associated with diabetes are many, which we discussed: decreased T lymphocyte response, decreased neutrophil function, the disorders of humoral immunity, antioxidant systemic depression, the angiopathy, neuropathy, and large number of medical interventions, the lower secretion of inflammatory cytokines, glucosuria, GI tract dysmotility, the hyperglycemia, and increased virulence of the infections, microorganisms, and apoptosis of polymorphonuclear cells are the summary of immune alteration in a diabetic, which makes them more prone for the influenza or any other infection. So they're complicated, and living loss, and 65% of the reported deaths are due to the cardiovascular complications, and these cardiovascular complications are precipitated by a attack of influenza or a respiratory tract infection. It also confers an increased risk of developing and dying from the infectious diseases, and the mortality morbidity associated with infectious diseases like influenza and pneumonia, which are preventable by a vaccination. Though the people of all ages are prone to infectious diseases like pneumonia and influenza, the extremes of age and the children, they are the people suffer more commonly with the infection when they have diabetes, asthma, or the coronary artery disease. The diabetes results in increased risk of infection and death, and almost, if you see the data, 5 to 15% increase in the mortality, and 6-fold more likely to require hospitalization, and annually 10 to 30,000 deaths in people with diabetes associated with respiratory complications like pneumonia and influenza. And the role of diabetic in the severity of 2009 pandemic influenza was studied in different countries like USA, Spain, Canada, and if you see, there are various data which have proved the commonness of the involvement of the diabetic patients and their outcome. The animal models of diabetes and influenza, where there is a mouse model is utilized for induced diabetes, and it has been seen that their infectivity has increased much more in comparison to the non-diabetic mice. And this summarizes the recommendation by different organizations of influenza vaccination, starting from ADA, CDC, the Australian Technical Advisory Group on Immunization, Canadian National Advisory Committee, and United Kingdom's Department of Health. All of them recommend universal vaccination in diabetic patients above 6 years unless there is an allergy to the vaccine or the egg. So the evidence of vaccine in elderly diabetic and very young children is not established, but they are recommended because of the good safety profile and absence of effective preventive interventions for influenza and risk of diabetic for developing severe disease. The working age adults with diabetes experience greater susceptibility of seasonal influenza, a population-based cohort study confirmed. So a working person who goes to the office comes in contact with the other people, so they are more prone to the non-working group, and they must be vaccinated for not getting infection from their work field. The diabetes and the severity of the pandemic influenza H1N1 concludes diabetes triples the risk of hospitalization after influenza A, that's H1N1, and quadruples the risk of ICU admission once hospitalized. And the IDF, the International Diabetes Federation, concludes very important facts like a dangerous complication of the flu is pneumonia. The people with diabetes are more at risk of developing these complications than people without diabetes. Flu and the other viral infections can lead to higher blood sugar levels. Not only the uncontrolled diabetes makes them more prone to infection, the infection itself leads to hyperglycemia and very high blood glucose levels. And people with diabetes are 6 times more likely to be hospitalized. I have already shown you the influenza during flu outbreaks, and the guidelines by WHO, by ADA, by EASD, by RSSDI recommend diabetes patients to get their flu vaccine at the start of every flu season as per recommendation. The recently published data confirms the vaccinating people with diabetes against influenza sensible thing to do. That is published in 2017 vaccine. But people with diabetes seem to be unaware of the potential risk of influenza infections. In Germany, only 40% of the people receive the vaccine. In Poland, it drops to 10%. And you know the status in our country. So the influenza prevention being treated as integral part of the healthy aging, and every elderly patient, though immunocompromised and the response to the vaccine is less, should receive the vaccine. And overall influenza vaccine rates, high risk groups continue remains below target worldwide, and coverage household contact persons with diabetes mellitus is 30% lower than diabetes mellitus patients. At times, we vaccinate the patient, forget about their household contacts who can infect our patients very well. So this is a study which was discussed by Pobes, that why people think that they should not accept. As they published in vaccine, they conclude that many people think that they are not aware about the vaccine, especially women. They think that there can be some adverse effect. Around 30 to 20% women, fear of adverse reactions, and almost 90% agree that vaccine following their physician's advice for the age of the chronic condition.